Abe Shinzo has officially declared a month-long state of emergency for Tokyo, Osaka, and 5 other prefectures to curb the spread of infections. The focus is on putting an end to the epidemic.
Healthcare workers are facing a serious risk of being overwhelmed, and medical services are approaching capacity in many regions. The dire situation has made it clear that we have no time to lose.
The declaration covers the following prefectures and metropolitan areas: Tokyo, Kanagawa, Saitama, Chiba, Osaka, Hyogo, and Fukuoka. It will be in place until May 6th. The 7 governors can now enact measures on their own to counter the virus. Abe says he is concerned about the situation in Tokyo, which has a quarter of all confirmed infections at around 1,200. He says at the current pace, the capital will see over 80,000 cases in a month.
According to experts, if all of us help to reduce person-to-person contact by at least 70%, and preferably 80%, the infections will peak and start to decline in 2 weeks.
Abe again called on residents to stay home and avoid non-essential outings for a month. He reiterated that his administration will not impose a lockdown, as some foreign governments have. Abe says he will try to minimize the impact on economic and social activities. Public transportation and supermarkets will remain open. He also said the government will pass a $1 trillion financial package. Abe says the unprecedented stimulus amounts to about 1/5 of Japan's GDP. After the declaration, Abe said in an NHK news program that he will lift the declaration when group infections in Japan are under control.
We assume that a vaccine for the virus will be available between the end of this year and the beginning of next year at the earliest. That could end this pandemic.